Assalamu alaikum wa rahmatullah. Good evening, everybody.
Wa alaikum assalam.
Inshallah, we'll be starting our session for today. This is Hana Muhammad from Friends of Cancer Patients Society. Friends of Cancer Patients, in collaboration with the University of Sharjah, is honored to welcome Dr. Khuloud Bajbouj. She's an assistant professor at Basic Medical Sciences Department at University of Sharjah, to present for us today a session regarding the gallbladder and bile duct cancer. Ladies and gentlemen, kindly keep your mics and cameras off. Also notice that the attending certificate link will be shared with you in the chat box. Adding to that, if you have any questions, you can drop it in the chat box, and later it will be answered by Dr. Khuloud. Now I will pass the mic to Dr. Khuloud to start the session.
Thank you, Hannah. Good evening, everyone. Hannah, will you please let me know if you can see my screen, because I'm about to start the
Yes.
presentation. And is the voice clear?
Yes, it is.
Okay, thank you. So, welcome everyone to this awareness session. I'm Dr. Khuloud. I am a member of University of Sharjah College of Medicine, and I'm honored to be able to give this awareness session that will cover some information regarding gallbladder and bile duct cancer. It is well known that the cancer, every month we will have an awareness session conducted related to a specific type of cancer, and the month of February is dedicated to give people some general information about this specific type of cancer, how we can prevent it, what are the risk factors, signs and symptoms, so for the general population to know and be aware, and so that they can spread the information given to them via this lecture. And thankfully, this session is being supported by the Friends of Cancer Patient Foundation, which work under the umbrella of the Supreme Council of Family Affairs under government of Sharjah. So I've been doing cancer research for the past 12 years, and I came to know that with all the devastation that the family and the patient himself or herself has to go through, cancer is in large population preventable, and that what made me have the passion to talk to the general population, make them aware and make them know that if you know that the causes, you can prevent them yourself. So to begin with, what is gallbladder? Have you ever heard about gallbladder? Where is it found, and what can we learn from it? Is it removable? And if a cancer or any condition happens to be there, what can we do? Can we interfere? Is it too late? So to begin with gallbladder, even for the people who don't know where is it, it is part of the gastrointestinal system or the digestive system, where the food is. I think someone is
أنا هذه تدوي هي فهمتهاش به.
That is muted. I can hear other voices.
Please, can you keep your mics off, dear attendees?
كيف نحضر الدنيا الظلمة؟
لو سمحتي. Excuse me. ممكن نغلق الميكروفونات والكاميراز لو سمحت. تفضلي دكتورة خلود.
Okay, so going back to gallbladder, as I just said, it's part of the digestive system, and whatever food you ingest, it will go through the esophagus into the stomach. The stomach will try to break it down into smaller particles and then send it to the intestine for absorption. However, this one direction pathway will need along the road some help. help of the so-called digestive enzymes. Certain enzymes will be produced by other compartments of the digestive system to break them down and try to get you the maximum benefit. I still can hear some noise in the background, Hannah. So what are the contributor to make the food that you get, what you eat on a daily basis, beneficial? To absorb the proteins, absorb the fats you needed for your daily exercise. This can be achieved by other compartments of the digestive system, including the liver and the gallbladder. So the gallbladder is known to be part of the GI system. Location-wise, you can see it right here, just beneath the liver. And after your meal, usually the gallbladder has certain juice inside it, and we call it the digestive juices. Those will be secreted through the so-called bile duct, which is a small canal, you see it right here, into the intestine. And this will help you basically break down fat and absorb it, because you need fat at the end of the day to get the energy from the food. Of course, carbohydrates give you some energy, but for the long-term energy storage, you need the fat taken from the food. And the gallbladder will help your digestive system achieve this. So the gallbladder is right here. Empty the component, the so-called bile, into the bile duct, and the duct will transport the materials or the digestive enzymes into your intestine or to help absorption or breaking down and absorption of fat. It is necessary. It does help in digestion process to make it faster, but if someone has to remove it for whatever reasons, it won't really affect majorly. Okay. But the problem with the cancer, particularly in gallbladder, in a minute I'll be explaining that usually it is not detected at early stage. But what is cancer to begin with? Cancer is a disease that is known to create most of the time a solid tissue, right? Not needed. And we say it's the uncontrolled growth and spread of abnormal cells. Those abnormal cells will start feeding on the normal cell nutrition and thereby damaging any tissue that they grow on. Yani, let's say if we have, for instance, a stomach cancer, eventually the patient diagnosed with stomach cancer will have a problem with digestion food, because all of the support that the stomach usually gets for it to fully function will be diverted to those abnormal growing cancerous cells. Where does it arise from, the cancer? Usually the cancer comes from mutations. The cells, your cells are undergoing division on a daily basis. You have even around 50 million cells on a daily basis dividing. But what makes them normal versus abnormal is the mutations that happen in the DNA. Normal cell usually contain their growth. They don't overgrow. But the cancer cells, for some reasons, they get mutations, so many risk factors and causes of cancer. And once they overcome this control mechanism to stop their growth, they become cancerous. Keep in mind that not every abnormal growth is considered to be dangerous. Sometimes benign growth, like the mole on top of the skin, this is abnormal growth, yet not too dangerous. We don't consider it to be malignant. The malignant abnormal growth of cells right here, this is the one that's cancerous, and this is the one that needs medical intervention. And this one, if we don't interfere and try to stop their abnormal growth, will become fatal to the patient. And it will cause eventually death if not being treated at early stages. To go back to gallbladder cancer, what is known about this type of gallbladder, this type of cancer, it is rare. Luckily, it is not that often in terms of cases worldwide when you compare it, for instance, to breast or colon cancer. Gallbladder is known to be one of the least common type of cancer. However, the dangers associated with this type of cancer, that's not really detected at early stages. Always, whenever we talk about cancer, we talk about stages. how far it went beyond the contained level. So stage 1, 2, 3, 4. If we reach stage 4, this is very dangerous. So the cancer has spread all over the body. At stage 1, it is highly contained. So when doctors usually detect such type of cancers, they can simply remove it and treat it, and the patient will survive for a long period of time. But the problem with the gallbladder cancer, although there are few cases, it is not early detected, making it a bit problematic when it comes to management or treatment. So since the gallbladder cancer not discovered at an early stage, like let's say stage 1 or 2, preferably what we really as doctors prefer to deal with is the stage 1 cancer. But when we go beyond that to stage 4, it's a bit hard to contain. And it's going to be spread all over the patient body. How about the distribution all over the world? It is not, it's somewhere, as you can see here, as per statistics, according to the World Health Organization. You can find it very common, for instance, in China, in few countries in North Africa, South America. In the UAE and the Middle Eastern countries, it is relatively common, but not too common as breast. Another statistical analysis of the gallbladder cancer cases in the UAE, you can see here, for instance, the breast, which is a top at rank number 1 among the new cases discovered each year in the UAE. And you can see here how many deaths this type of cancer is causing, around, let's say, roughly 230 cases per year, which is high based on the population. The UAE population is relatively low in comparison to other countries. And the 5-year prevalence, it's in all ages. If detected early, the prognosis, or what we say the life expectation of the patient, is long. Where is gallbladder here? Colon is common as well in the UAE, thyroid, stomach. But when we look at the gallbladder, it's just at the very bottom list of the common cancer types in the UAE. It ranks at place 26. However, as you can see here, the prognosis, death is very, unfortunately, very associated with the detected cases. It causes a lot of death. Why? As we said, unfortunately, when the patient is diagnosed with the gallbladder cancer, it is already at late stage. So it's no longer contained. And that's why we are here, to give you the information, what are the alarming signals, how we can detect it, how we can spread the knowledge that this type of cancer is detectable. It's even preventable, by the way. So gallbladder signs and symptoms, any person, if he or she has the following symptoms, this can be very alarming, and they need to go seek medical advice immediately. People diagnosed with gallbladder cancer, they present to the clinics with the following signs and symptoms. It could be steady pain in the upper right, of course, because this is the location where the gallbladder is found at. Indigestion, there is difficulties in digestion food, vomiting, loss of appetite, weight loss. طبعا sudden weight loss. I'm not talking about regular weight loss. All of a sudden, within a few weeks, you're losing more than 10 kilograms. This is alarming. Jaundice, which is the yellowing of the skin. The skin color become all of a sudden yellow because difficulties in producing or in the liver function, accordingly in the gallbladder digestive enzymes. And also very common is gas, or what we call it dyspepsia. I'm sorry about that. Risk factors, who is more susceptible to get gallbladder, does not mean that everyone with the following features will eventually get it. Usually studies show that there is a strong correlation between the incidences of cancer, gallbladder cancer, and the following risk factors. Gallstones, which are the stones found in the gallbladder. Porcelain gallbladder, what do we mean by that? Calcium If you take a lot of, for instance, vitamin D without consultation with your physician, usually it leads to stone formation and porcelain. We call it porcelain because it will look like the porcelain that you see it, you use it in the houses. So it looks a bit rigid. Female, unfortunately, the gender, so it's more common among females when you compare them to male. Obesity, very strong risk factor, which is associated, by the way, with all type of cancer. Similarly, smoking, both smoking and obesity, even diabetes, is correlated with all type of cancer, not necessarily only gallbladder. Family history, there is a link. If you know someone in your family which might have it, or you've heard that it is somewhere in the family, I highly recommend that you go get tested. Exposure to chemicals, what we call them the carcinogens. So there are a few chemicals like found in the textile or rubber. There are also been excuse me, they've been also associated with incidences of gallbladder cancer. So people who are with the following symptoms and also do bear some of these risk factors are highly recommended to go seek screening options. You don't have to panic. You don't have to be frightened. All you need to do is find a doctor, a physician, preferably internal physician, to get screened. Another type of cancer that is also related to gallbladder cancer is bile duct. Why do we say both are related? Look with me at this cartoonic illustration of the liver. You see here the liver, right? And you see here the gallbladder, and you see something that is common. Common in terms of both organs empty their digestive enzymes into. The liver being a very good organ that cleans up the blood from any toxins, it is also known to participate in the digestion process. Any food that is being ingested can be broken down into several smaller units by the help of enzymes released or produced by the liver. Another set of enzymes, digestive enzymes, is also being produced by gallbladder. Both enzymes, you can see, they empty their component into the so-called bile duct. It's a canal that's linked to the intestine, and digestive enzymes coming from liver as well as gallbladder, they get emptied into here and then transported accordingly. So we would expect any problem in the liver or in the gallbladder might affect the structure and the component of the bile duct. So if someone has, for instance, hepatitis, any hepatitis virus infection, okay, they might eventually have an effect on their bile duct because it's connected. Similarly, if you have a problem with your gallbladder, it is going eventually to affect the bile duct. And sometimes, as we said, if the gallbladder cancer has been detected at a late stage where already the cancer cells are spreading all over the body, it might also affect the bile duct, causing cancer formation right here. So what is the differences and also similarities between the bile duct cancer and the gallbladder cancer? Symptom-wise, you may say, well, they're pretty much similar. But however, since we have right here the liver involved, symptoms and problems related to the liver might also occur in people diagnosed with bile duct cancer. Why I keep on speaking about symptoms? Because you know your own body. You can see differences and you can distinguish what is normal versus what is abnormal. So keep very well attention to the changes that's happening to you. Are they for a short term or are they for a long term? If you have, for instance, resisting itching, along with unexpected weight loss, you have also persistent pain in your right side and loss of appetite, not for a 1 day, not for 2 days, for a month. So that's why we call it persistence, goes for a long period of time, you need to go seek help. Don't just ignore any abnormal symptoms that you are going through. It could be alarming. It could be something temporary that you need like the short-term medical intervention, but sometimes it might lead also to cancer, unfortunately. So the symptoms similar to, for instance, jaundice or yellow skin, you can see it also in gallbladder cancer patients. Similarly, they're very common in bile duct cancer patients. How about risk factors? Do we have any common factors between the gall and the bile duct cancers? Yes. Obesity, remember, we said that family history, it is familiar, yeah, can run in the family. Diabetes, smoking. Here we talk more to problem with the liver. So people with hepatitis, viral infection, they might end up developing bile duct cancer. Older age, of course, the older the person gets, the more problem in their system might arise, including cancer development. How can we get screened? How can we get tested? Is it a complicated approach? Is it doable? What test I have to go through to find out whether if I am showing the symptoms that we have discussed, probably there is a problem. The diagnosis can go all the way from the simple blood withdrawal to get tested for certain cancer markers, or all the way to get a biopsy. But it is not the three-step altogether. Usually the doctor will ask for a blood test, followed by scanning, like ultrasound, and they will put you under a scanner imaging system to look into internal organs, whether there is an abnormal growth or not. For instance, the ideal is for soft tissue like the gallbladder and the bile duct to go for CT scan. MRI scan is very advanced, okay, the one that people usually go sleep on their back and then goes into a machine, and the machine will give some sounds and thereby screening through the internal organs. But ultimately, what will really determine whether this abnormal growth, if detected through those scanning techniques, is cancerous. As I said, not every abnormal growth is malignant. The doctor eventually will have to take some tissue. We call it in medicine biopsy. So he or she will take some tissue, have it analyzed properly to detect whether this abnormal growth is dangerous, is malignant, or just simply benign. Then, if the doctor detects that this is an abnormal growth, it's a malignant, unfortunately, cancer, they will offer the following. Very common: surgery, removal of the whole gallbladder or the bile duct, followed by radiotherapy and chemotherapy. But of course, and I'm sure you have heard about any individual in your family, from your relatives, friend zone, a parent who is undergoing radio or chemotherapy. What are the major side effects that goes along with such type of treatment? It can cause nausea, vomiting, loss of hair, loss of appetite, and not all the time effective. It depends on the patient. Some patients react very perfectly with the treatment, some don't. Most advanced nowadays, it's for the past 5 years, is immunotherapy. Why immunotherapy? For the people who don't know about immunotherapy and where does this concept came from, let me introduce you to a very brief information about your immune system. The system that fights microbes, not only microbes, like nowadays we have the COVID, and we always recommend that you take care of yourself, you eat healthy diet, you keep exercising to improve the performance of immune system. So does your immune system only capable of fighting microbes or pathogens like bacteria, viruses, or fungus? No. Your immune system can correct any error, internal as well as external. Your body, by the way, is capable of producing 50 million new cells each second. Imagine. And each single new cell might have an error. Remember the error I talked about initially, the mutation? How your system is capable of correcting this error. So if you're creating 50 million cells each second, some of them might be cancerous, right? It can be a tumor cell. So how can we not develop cancer on a daily basis? Because your immune system is alert. It does work to kill any cancer cells that have an error. But imagine if you have a weak immune system because you're not sleeping enough, you're not having a healthy diet, you're not exercising, you're not managing the stressful conditions properly. This all will lead to a weakened immune system. Not only make you susceptible to microbial infection like COVID, like hepatitis, like bacterial infection. لا, حتى even your cancer cells that are developing on a daily basis without you knowing cannot be fought back. So if you have a strong immune system, definitely your body will react to any internal error or microbial infection properly. Another very important information that I need to bring to your attention, that many hundred different studies, they showed that whenever people are under stressful situations, they have very weakened immune system. I just want to mention one of those studies, which I usually remind my students every now and then of. They have conducted a study over a period of a year with college students. And they found that whenever those students having any exams, whether quizzes, midterm exams, or final exams, they took some blood from them just before and after their exams, and they looked for specific type of cells, immune cells, called the natural killer cells. Those are the cells that we call them the frontliners. How is the frontliners nowadays with managing COVID? Those are the frontliners cells in your immune system. They found among those students that just before the examination, 2 days prior to their examination, they measured the lowest level of those immune cells. So imagine how stress affects the number of your fighter cells, like the immune cells. So you have to have the ability to cope up with stress in order to improve the performance of your immune system. And therefore, scientists have developed immunotherapy. It's very effective treatment options for so many types of cancers, and so many studies have showed the efficacy of immunotherapy on gallbladder cancer. So what have we learned? Of course, since 80%, by the way, of all human cancers are related to lifestyle or environmental factors. It's not only family. It does not mean that if, for instance, the dad in the family has it, or the mother or the grandparent, they have a specific type of cancer, this means that eventually the kids will develop it. You have the choice to improve the performance of your immune system to fight back. How? What are the choices that you can take? It's purely up to you, whether you want to fight back or sit and wait for the cancer to be developed. So you need to cut on tobacco, no smoking. Hold the fat. Definitely, this is very important. Not to take a lot of fat in your food or in diet. Only if ever, moderate use of junk food. I know it is irresistible, but try to have an average. And I do advise not at all. Of course, you need to increase the fiber in your diet, like taking a lot of fruits, veggies, and grains that has the so-called phytochemicals, or what we call them in medicine, antioxidants. Akid, you've heard this term over and over. It does really improve the performance of any body cell. Call your doctor for regular checkup, no matter if you're young or old. As I said, if you see persistent symptoms, abnormal symptoms that you're not used to, seek help. Just go have a normal checkup. Exercise at least 30 minutes a day. I know it's a hard thing to do, but try to walk, even if you're studying, even if you're on the phone. Don't sit, walk while talking. And this is thereby you're doing exercise without you knowing. Safeguard your life from stressful conditions, very important. And those are your choices for you to choose. So to review, um, cancer is a problem, unfortunately, in our community, affecting every single family, whether you like it or not. You have to know the risk, very common among the majority of cancers. Know what is normal for you, very important to pay attention to any changes. Get screened and make healthy lifestyle choices. And I hope if ever you have learned anything today, to share it with someone you care about. Questions?
Thank you, Dr. Khuloud, for such informative and important session. Of course, we learned a lot, not only 1 or 2 points, and of course, and I'm sure everyone will share it with their beloved ones. Kindly, attendees, if you have any questions, Dr. Khuloud would be more than pleased to answer your questions, please.
Assalamu alaikum.
Wa alaikum
Hello.
assalam.
Hi, doctor. I have like 3 questions. First
Sure.
question, non-alcoholic fatty liver disease. I didn't understand it. It was on the
Yeah,
sentence.
when it comes to fatty liver disease, could be alcoholic related to alcohol consumption. It could be sometimes to obesity or overweight. People with overweight, usually they have fat accumulated on their liver, which will reduce the efficacy of the liver function. So
Okay.
if they're obese, they might have higher chances to develop the cancer eventually.
Thank you, doctor. Second question, for people that they extract the gallbladder for some reason, they have infection in their gallbladder or something, and they already removed their gallbladder. So is this will affect on their weight loss? Like if they want to lose weight, it will affect them because their gallbladder is already removed?
A
ولا
little bit.
عادي؟
No, a little bit, yes. This is a very valid question because usually the gallbladder secretes enzymes that breaks down fat, and you would expect fat to be more accumulated in their system. But with exercise, even if they have it removed, it will take a bit longer for them. Nevertheless, people sometimes it might contribute, but some people might have their fully functioning gallbladder, yet they're not losing much weight because their metabolic rate is not efficient. So it might affect, but doesn't really all the time contribute.
Because I'm nutritionist, so I have some patients where their gallbladder already removed. So I said it might be because you remove, so it's hard for you to lose the weight, or maybe because you're not doing a real exercise or a real diet in doing this to lose your weight. I mean, because of this,
Yeah.
I ask about this.
Yes, and you have noticed among your I don't know, people who seek your advice is that they vary, whether they have it or they don't have it. It all depends on the metabolic rate, their capability to break down their food. Of course, the gallbladder contribute majorly to that, but I believe among families, their amount of energy breaking down and their mitochondrial function, if I want to be more precise, does differ among even siblings in the same family.
Yes,
Do you agree with me?
of course. Yeah.
Yeah.
Okay, last question. The immunotherapy for people with like multiple sclerosis.
Mm-hmm.
You know that whenever their immune is low, they are fine. Whenever their immune is high, they got relapses.
True. MS is an autoimmune disorder, and if you want to manage it, one of like the best treatment options, unfortunately, is to give your patient immunosuppressant medications.
Exactly.
And thereby you're affecting their immunity. But it's a double-edged sword. If you want to ease down their symptoms with MS, you have to compromise their immune system. But on the other hand, you're making them more susceptible to infection, even internally, to problems, the errors that we have talked about. To overcome this is have them follow a healthy lifestyle. Just try to balance the loss of efficient immune system that the medication is causing.
Okay, thank you, Doctor.
You're most welcome.
Thank you, Sarah, for your valuable questions, and thank you, Dr. Khuloud, for answering her. Does anyone have any questions?
Oh, thank you.
Do you have any question? Mr. Bajbouj,
Doctor, since no one is asking, last question, I'm sorry. If someone remove his gallbladder, okay, and the bile duct, this will not affect him in digesting the food? Like it's only the liver will digest the food going to the intestinal directly?
And they might have difficulties, discomfort even.
And how they can come over it?
Low-fat diet.
That's it?
High fiber, yes. So to enhance the overall the digestion process by low-fat, high fiber.
I'm really thankful for you.
You're most welcome, dear.
again, thank you, Sarah. We would like to thank Dr. Khuloud. We would like to thank Dr. Khuloud Bajbouj. She's assistant professor from Basic Medical Science Department from University of Sharjah. Ladies and gentlemen, if you wish to join us for future sessions, please follow us on FOCP.ae in the social media. Hope to see you all very soon. Stay safe and have a peaceful night. Thank you, Dr. Khuloud.
You all take care. Bye-bye.